Hi, I'm Dr. David Wong, and I'm a periodontist here in Tulsa, Oklahoma. Today, I want to talk to you about receded gums or gingival recession. A lot of people don't know this, but over half of all the people in the world will at least have one tooth with a receded gum or an exposed root or gingival recession. They're all kind of all interchangeable terms. But anyway, just because you have receded gums doesn't necessarily mean you need treatment. You can have a receding gum line and still be healthy or at least stable, even though it's not perfectly quote unquote normal. As a periodontist, we see this every single day. I'd say at least half of our patients come for consultations because they're worried about their roots being exposed. So what I like to do when I meet patients for the first time is just do an examination where we take measurements of their gums, teeth, and bone, take x-rays of the bone and everything like that to see if they're, number one, healthy or not healthy, stable or unstable. So the very first appointment is all about assessing risk of progression, risk of irreversible disease, or risk to other teeth. So the last thing people want to hear is, hey, something is permanent, your condition is permanent and it can't be fixed. So the earlier that we can detect gingival recession or receding gums, the better. Why is it better? Because what happens with gingival recession is not only are the roots exposed, but that can be associated with bone loss. And bone loss, a lot of people don't know this, bone loss in the mouth is largely considered irreversible. So we don't want that. Matter of fact, the more bone you have around your teeth, the better your chances are of being able to completely and 100% correct your receding gum line. So early detection is very, very key. Now, how do you know you need anything though? Because a lot of people aren't self-aware of what their gums are supposed to look like. And a lot of times these things do not have symptoms. There's no sensitivity like you would think there would be. There's no pain or bleeding or anything like that. So a lot of people are totally unaware. If you are aware of it though, and the cold sensitivity bugs you, or maybe you don't like the way it looks, call your dentist, your dental hygienist, or somebody like me, a periodontist, as soon as you can. As far as let's just say, we do our exam and yes, you have gingival recession, your roots are exposed, you have sensitivity, or you don't like the way it looks, what do you do about it? There's several treatment options, but largely we consider two main ones. They're both gum grafts. One is a gum graft where you take skin from the roof of the mouth. The other one is where you use cadaver tissue or donor tissue. Now, which one's best for you? There's a lot of determining factors in that. I would say the best way to figure this out is to make a consultation appointment with your dentist or periodontist, and we can tell you and help you out with that. But generally speaking, you can always count on both procedures. If that's chosen to be the right procedure for you, more than likely it's going to work. They both have very high success rates, especially if you detect your problem early. The biggest thing with the difference, of course, is going to be your pain and discomfort post-operatively. When you take skin from the roof of the mouth, while it's got a very high success rate, it also hurts. Some people will say it doesn't hurt, but the large majority of people say taking skin from the roof of the mouth hurts pretty bad. On the other hand, if you use cadaver tissue, there's only one surgical site, and that's where your receded gum is. So that is associated with a lot less pain. So a lot of people will opt for that. They're not interchangeable procedures though all the time. There are certain indications where we have to use your own skin. There are certain indications where we could use either. So once again, if you have any questions or concerns, make an appointment with a dental professional and let's get that looked at. If you catch it early, you can have very beautiful results. If you don't, sometimes we're just hoping to maintain teeth, but at any rate, you want to catch it before it gets too far out of hand. So I hope that helps, and I'll talk to you soon.